Hello, my name is Blake Becker,
My name is Justin Gordon.
and for our project, we looked at safety in mental and behavioral health patient rooms. So, looking at our project introduction, why we chose this topic. Safety is the most critical aspect of mental and behavioral health facility design, and eliminating potential hazards such as laser points, impact-prone materials, and poor visibility can help to reduce the risk of self-harm, accidents, and other negative situations within these facilities. A well-designed space can not only protect patients, but also enable staff to provide effective care. In creating a toolkit, it works to help offer a structured approach to assessing and improving safety in mental and behavioral health patient rooms and work to prevent potential risks before they arise. In terms of the impact on particular age groups, the goal of our toolkit is to enhance safety for both adults and adolescents in mental and behavioral health facilities. While adults may require spaces that prioritize durability and self-sufficiency, and adolescents often need additional supervision, safety is still the key concern for both of these age groups. In addressing the unique needs of each age group, this tool ensures that patient rooms remain secure, functional, and supportive of recovery for all stages of life.
When creating our toolkit, we discussed several different design features, the first being ligature and self-harm prevention, some criteria, anti-ligature items, and eliminating ligature points, like with doors, shower heads, and bathroom fixtures. These reduce the risk of self-harm or harm to others. Features in patient toilets, ligature-resistant faucets, recessed cabinet pulls, and securely locked doors that enclose under counter pipes. Grab bars also must have safety precautions with limited mobility and gaps. And then a few methods of evaluation for this criteria. Mock-ups in this case are going to be a great method for evaluating, which can be which can be measured with the level of safety and ability to harm oneself or others. Patient health and comfort must be evaluated, which can be done in mock-ups by testing finishes and furniture. The second criteria is impact-resistant and tamper-proof materials, um, such as fiberglass reinforced wall panels, shatterproof polycarbonate glass for windows to ensure durability and safety, tamper-proof fixtures by installing special locking mechanisms and tamper-resistant hardware on doors, windows, and furniture. Safety first furniture by choosing furniture with rounded corners to minimize injury risk and select safety grade designs to withstand patient behavior. Non-reflective finishes by opting for matte or low glare finishes on surfaces to reduce visual stress and agitation. And then a few methods of evaluation can be physical testing, environment audits, and measurements. This will provide consistent results across evaluators, while subjective factors may lead to slight variations based on personal perceptions. And then the third criteria is visibility and supervision for staff. The criteria being clear lines of sight from staff and family zones, strategic placement and of observation windows, and non-intrusive supervision methods like one-way mirrors. These features enable staff to monitor patients effectively while respecting privacy, enhancing safety, and improving response times. Adequate lighting and minimal obstructions further ensure continuous visibility, contributing to a safer and more therapeutic environment. And again, with this criteria, mock-ups are going to be your best method of evaluation for safety, layouts, finishes on furniture and equipment, and then observation measurement on drawings and simulations can be used to assess sight lines and furniture placement and the effectiveness of surveillance systems.
So, taking a look at the toolkit that we created based on these design features. Firstly, mental and behavioral health patient rooms require specialized design considerations to ensure their safety while maintaining a therapeutic environment. The goal of this toolkit serves as an evaluation guide to help assess key safety aspects of these spaces, helping architects, healthcare designers, and facility managers identify potential risks to help reduce future problems. By following the outline criteria and rating system, users can help review patient rooms to enhance their safety, durability, and visibility while maintaining patient dignity. Taking a closer look at the toolkit itself, the toolkit is organized into three main design features that we previously mentioned, including ligature and self-harm prevention, impact-resistant and tamper-proof materials, and visibility and supervision. Each of these represent a specific area of safety-related design. Within each of these categories, we've identified specific criteria used to assess the room. Most of these criteria are scored based on total counts. For example, how many potential risks or unsafe features are present within the room. Others are evaluated using yes or no responses or total distant measurements. After completing the assessment, the user will total the points earned based on the conditions of the specific patient room. This generates an overall safety score for that room, which can then be used to evaluate its safety level. What makes this toolkit especially helpful is that it doesn't just provide a single score. It also works to highlight which specific design features need the most improvement, giving users a clear direction for enhancing safety in targeted areas. To evaluate the effectiveness of our toolkit, we took a look at Conwood Creek Behavioral Hospital located in Idaho. This patient room is a great example of a safe patient room, but still has some key features that could use improvement. Some of the first, when looking at the patient room, include a few movable furniture objects and a few edges that could cause potential self-harm. The door as well is missing a window to within, which can reduce the visibility aspect for the staff. Along with the visibility, there are multiple blind spots that can be seen throughout, which are something you want to eliminate within these patient rooms. Taking a look at the bathroom, similar to the patient room, blind spots seem to be the main downside. There's also slight problems with the edges of the mirror and the anti-ligature shower faucet. So taking a look at how our toolkit has scored, we've added up the features we've found throughout the design and added them up to get the final scores of each design feature. With an overall score of 64 out of 75, it meets our ideal range of what we believe to be effectively safe mental and behavioral health facility patient room. One of the key things we can see here is visibility and supervision have gotten the lowest score out of the three design features. This helps indicate to the architects and designers what they need to focus on the most, with that being visibility and supervision, ligature and self-harm prevention next, and lastly, impact-resistant and tamper-proof materials the least.
So as you can see by our toolkit, the overall design did very well. Just to point out a couple strengths, often found were correctly fastened furniture, the lack of hooks or sharp edges in the room or on any furniture, such as shelves, beds, windows, and mirrors as well. And then plumbing fixtures are tamper resistant apart from the shower knob itself. And then fasteners and joints, for the most part, are tamper-proof throughout the room. And then tamper-proof resistant materials and finishes, such as the shelves or lighting fixtures, are also very safe. And then calming materials and finishes were also used to prevent agitation in patients. And then just to point out a couple of the weaknesses again, there were several blind spots in the room as we just showed. There were some jagged edges along shelves which should be eliminated. And then there's a lack of visibility and access from the nursing stations, as it is somewhat of a long distance to the farthest room, and there's also no windows into the rooms.
Lastly, our works cited shows the list of sources we use to guide ourselves along the way of creating effective and helpful design toolkit to overall improve the safety within mental and behavioral health patient rooms. Thank you.